Down syndrome is a congenital disorder linked to the total or partial duplication, growth, retardation, and produces certain physical abnormalities, including a flattened face, especially in the nasal bridge, almond-shaped eyes, and slanted upward and a short neck. It is a genetic disorder, although it is mostly not inherited, but arises from an error in cell division in the early stages of fetal development. Some risk factors for having a baby with Down syndrome are an older mother, being a carrier of the Down syndrome genetic translocation, or having had a child with Down syndrome. In addition, there is no way to prevent it, and it can be diagnosed during pregnancy. There is a possibility of comorbidity with heart problems, gastrointestinal defects, immune disorders, sleep apnea, obesity, spinal problems, leukemia, dementia, and other problems such as endocrine, dental, seizures, ear infection, hearing, or vision problems. There are 3 genetic variations that can cause Down syndrome. The first one is trisomy 21. The 95% of Down syndrome cases arises from this. The person has 3 copies of the chromosome 21 instead of the usual 2 that all the normal people have in all their cells, and it happens during the development of the sperm or egg. The second one is the mosaic Down syndrome, and it is rare. Some of the cells have an extra copy of the chromosome 21. It occurs after fertilization. And the third one is the translocation of the Down syndrome. Down syndrome can also occur when part of the chromosome 21 attaches or translocates to another chromosome before or during conception. These children have the usual 2 copies of the chromosome 21, but also have additional genetic material from chromosome 21 attached to another chromosome. The learning rate of people with Down syndrome is lower than the rest of the population. Their attention span and memory are lower. They have poor muscle tone, that fine and gross motor skills are affected, and they have relatively short fingers and toes. Most children with Down syndrome have mild to moderate cognitive impairment. Their tongue is protruding. Some subjects have difficulty in speaking, which could also affect their school process since they present language delays. For the inclusion of students with Down syndrome in schools, the role of the educators is fundamental. So, they must be prepared to understand how these children learn, detect their strong competencies, and choose didactic strategies that allow them to get the most out of their work in the classroom. It is important that the student participates in the activities, in addition to prevent with them to consolidate the knowledge of facilitating the understanding of the content. So, breaking down information into degrees of difficulty is very helpful. By using drawings or videos, students with Down syndrome will retain the information better, in addition to keeping it brief and varied, since these students tend to get tired or lose attention. Teaching them to be independent and to establish clear routines, teaching them about personal care, the use of materials, and to move around the center on their own, helps the children to adapt to society. Helping them to improve their motor skills is also important. So playing sports or games involving physical activity may be helpful in developing their hypnosia and coordination. There is no standard or single treatment for Down syndrome, as this depends on the physical and intellectual needs of the patient, their skills and personal limitations. But when they are children, it is recommended that they see speech therapists, occupational therapists, physiotherapists, as well as educational therapy. Early intervention improves outcomes. It is important to explain that the Individual with Disability Education Act allows children to have free learning services and devices, and they have the right from birth until they finish high school or reach the age of 21.